thoughts on the ways in which professionalism intersects with corporatization? And do you see those concepts in tension? Do you see them as on parallel tracks? Or how should we think about this concept that, as I understand it, you wrote the charter, partially based on it, and the ways in which corporate activity is increasingly a part of medicine?
Yeah, I would say on the charter, I did a lot of writing. I have to give David Rothman, now deceased, who's at Columbia University, and Jerry Kassir, who's still very much active in Boston, a lot of credit for their work on that as well. But the important part of the charter was, and it's interesting to sort of hear this whole discussion about sort of well-being, because the initial medical ethics was a sort of altruistic-based medical ethics that you were supposed to be putting yourself, not first, but the patient's interests were the most important thing. And so there was this devotion to the patient. There was like a relationship that was outside of commerce. The second part of it was the lawyers coming in and saying that individual patients had rights, and so the sense that patients had rights had to be part of sort of professionalism going forward. And then the third part that we really added was the social justice part, and that is you're responsible not only for the patient in front of you, but also for the system that you've sort of created, and to make sure that people have access to healthcare, and the healthcare was going to be sort of reasonably cost. And so I think, you take that to a sort of corporate setting, you've got to be thinking especially about that sort of third plank, which is, sort of are the things that you're doing making it possible for people to have access to healthcare, and are they making healthcare less costly? And I think you can see that in a lot of corporate activities. I think where people really get twisted and inappropriately sort of torqued about corporate is that there is this whole for-profit part of it, and there's also the sort of profit making by the executives. And that doesn't fit well with your sense of, I've got an impoverished patient here who I'm trying to sort of provide access to, and you think those two things just can't sort of fit together. But on the other hand, as I'm trying to say, sort of the corporate influences are meant to address what that structure of healthcare looks like to make sure that patients get what they need.